So, based on your CGM device, based on your handheld glucose monitor, should you make any changes to your diet? Welcome to drashori.com. My name is Dr. Mohammed Ashori. I'm a board certified family medicine physician. And this topic is important because I actually put myself to the test and I bought a handheld glucose machine so I could check my blood sugar for about a month. And I have many patients and clients who use a CGM to check their blood sugar. And based on the numbers they see, they often make a change in their diet. Now, is that a good idea? Not always, because sometimes a certain food is going to spike your blood sugar rather quickly. So, for example, if you have fruit or if you have oatmeal, it might rapidly spike your blood sugar, but it also quickly comes down. And you might assume that, okay, well, then I shouldn't be eating this food because my blood sugar went up to 180. There are a lot of people in the longevity space, in the kind of biohacking community who believe that your blood sugar should never spike. The problem is not every human anatomy and physiology responds the same way. Someone like myself, I'm going to go to 180, but I'm going to come down really rapidly. And the rest of the time, I'm sitting rather low. Some call this the area under the curve. There's many terms for it, but we're not going to get into the weeds of that one. And somebody else is going to have fruit and it's just going to go up a little bit and maybe stay up and come back down. So the area under the curve for both people, so you got this little area and then you got this spike, it might actually be the same, but the person who's going to see the 180 is told by their clinical expert that they should stop having fruits. The issue with that is the fruit you don't eat is replaced by something else. Now, if it's always just lean proteins and healthy fats, yes, that could perfectly be adequate and you might be quite healthy. However, if that fruit is helping you feel more satiated and it's adding a lot of fiber to your intestines, which then also decreases your blood sugar, your risk of diabetes and heart disease and prevents hemorrhoids, then you actually are doing a disservice to yourself by stopping it just because of elevated blood sugar. So, actionable steps, what can you actually do? My recommendation would be to use several different data points. Find out what your fasting blood sugar is. Find out what your hemoglobin A1C is. That's kind of the average of 2 or 3 months of your blood sugars. And find out what your fasting insulin levels are. Once you have a few more data points, you can take a look and see, all right, when I have fruits, when I have a little bit of oatmeal, when I have peanut butter, sometimes my blood sugar goes pretty high, but it comes down pretty quickly. So overall, if my metabolic profile is good, is there really any need for me to make any changes? Instead, maybe think about other things that could be contributing to the elevated blood sugar if that's what you're worried about. Maybe it's stress, maybe it's not enough sleep. The classic thing we see is that somebody who exercises, their blood sugar will actually go pretty high. Should they stop exercising? Of course, everybody agrees on that. No, please exercise. That's always a good idea. So just from blood sugar spikes, there's not a lot of information to derive. If your blood sugar goes high and stays high and then kind of slowly comes down, yes, that could be the food, but it could also be something else that you're doing. And so if you constantly just blame the food, you may not go upstream of the problem and solve that. Hope this is of value, and I hope I didn't scare you to think that, oh, all this data is useless. No, the data is valuable, but too much data can be confusing. And if you overall have a good metabolic endocrine function, the value of using a CGM or doing your home acu checks is not that valuable. And the last tidbit I'll throw at you is a CGM is really not that much better than the cheap old handheld devices. Yes, they're not that pleasant to use, but they can give you just as much data. You can check as frequently as you want. They're much cheaper, much more accessible, easier to use, and you can plot your own data using ChatGPT. It'll give you the same exact plot that you would get from a CGM device.